The Therapeutic Foster Care Program started approximately 5 years ago at Lutheran Social Services. The children are facing various issues or behaviors. It might be issues related to their mental health, trauma, or behaviors that are exhibiting from mental health, such as physical aggression, verbal aggression, or self-harming behaviors.
My name is Yvette Stringer. My husband is Raymond Stringer, and we are therapeutic foster parents for Lutheran Social Services of Illinois. I had a little experience with the traditional fostering. What got me started with therapeutic is because once I learned about it when the program started, I just really enjoyed the different kind of rules. And I would give you an example. Not chasing on the child if they run, but to be able to speak with them from a distance, non-threatening with your hands held back or folded or whatever, and not pulling on them and, trying to get them where you want them to be. I love that. That's kind of the way I worked anyway, so that was my favorite thing about that program.
When a child moves into the therapeutic foster home, they have the team almost within the home. So they don't live in the home with their team. They live in a regular home environment with caregivers that emulate parental figures. And then they have the support system that comes into the home to provide services on a schedule. They're setting up individualized therapeutic plans for the child placed in the home that fits the needs of the individual child. So it's not a cookie cutter therapeutic approach. It really looks at the individual needs using the TFC model. And it is a model that's actually used internationally. But what the TFC model does is a structured therapeutic model that utilizes a child therapist, a family therapist, and a team lead, as well as a skills coach, a caseworker, into the home with the therapeutic foster parents to provide varying supports.
I enjoy the gratitude after they get through the really, really hard times. And when you can start seeing that, they trust you now. They feel comfortable in your home. They feel like they're able to, talk more and be honest more, because it's all about communication. And so once they feel like they're comfortable and they're a part of that, that really warms my heart.
The need in Illinois is not unknown. We have residential facilities with long wait lists, and we have children that are waiting for extra therapeutic support that are not getting it in a timely fashion. We are meeting that need in collaboration with DCFS and the other private agencies throughout the state of Illinois.
If you got the time, the space, and the love, you can do this too, because there's so many children that really need that.
Therapeutic foster care has an amazing success rate. 73% of children who enter the program have long-term stability in one single home. So really being able to support the community and support the families in our community and the children who need that extra support so they can be stable and re-enter our community is very important.
When you're doing it right and you're doing it from the heart, you're helping someone. And if you can get one and get it positive and get them back home, you've done your part.